As far as preparing the patient, we like to make sure that our patients come in comfortable and they leave comfortable and happy. That's key. Dr. Lynn loves toys, as do we all, and we notice kids like toys as well. The kids love the fact that they got to play with a toy in a dentist office. That's not really normal. You go to the dentist, you get your teeth brushed, you get them fixed, and then you leave. The TVs are becoming extremely popular, I think, all over, so that wasn't anything to ooh and ah about either, but the toys are definitely something different because it gives them an opportunity to actually play with something. We also have coloring books for the kids who don't want to play with the toys and who aren't allowed to watch TV. So we try to keep them busy, preoccupied the entire time they're here, as well as talking to them and comforting them, because this could be a scary place. You know, we've got such a bad rap as dentists, but we want to make sure that this is a wonderful experience for them no matter what they're doing here. Working with other doctors, they kind of just go in. It's basically like a 1, 2, 3 step procedure. You know, you apply the topical and then you slowly go in with the syringe, you know, kind of conversating. But Dr. Lynn believes that we should show them everything so that they're not afraid of anything that they see. So we have definitely, we built up to this point, and we noticed that all these things together makes for a much nicer experience for the patient. With the show, tell, do, the fact that they get to see everything that we'll be using usually makes them feel a little bit better. I mean, after all, kids think that they come to the dentist and they're going to get a shot. Nobody likes that word. So we try to present our shot in such a way that they don't even realize that it's that. It's just this long blue tip thing, you know. They don't even care at some point. By doing that, we kind of desensitize them. So we go over different steps over and over again just to make sure that they're okay with the items that we're using, such as the nitrous, the laughing gas that goes over their nose. We do a show, tell, do. So we have them touch, we show them a lot, and then we actually place it over their nose in order for them to be comfortable with us using it. We also show them the air water syringe, which has the air and the water. We do it on their hands, we practice on their legs and their bellies, and also we give them a little drink just so that they can feel, so kind of tapping into all of their senses. We also do the suction, which we try on all of their fingers first to make sure that they're not going to be resistant or jumpy, and we also try it on their tongue just so that they can feel, because that's generally where we're going to be most of the time. By using it on their chin a lot and quickly, the senses seem to focus here instead of wherever they're being numbed at, because the numbing is not the most comfortable thing to have done. So the straw, whether it's here, here, their senses are kind of picking up on that. That's more uncomfortable than the shot. So that's what we try to do. We try to mask the shot by using the suction tip, as well as talking and laughing and giggling, all of those things put together. It takes their mind off of them actually getting a shot. I personally like to rub their hands because it's very soothing and it seems to calm them, alongside of the nitrous. That's already getting them in a relaxed stage. So I noticed that if I rub their hand or rub their shoulder gently, they're a little bit more accepting as to what we're doing. And Dr. Lynn, he proceeds to show them the syringe on their head, maybe not on their nose, but on their chin, their lip, and their hand as well. So we try to go into everything very smoothly. Also a lot of talking. Me and Dr. Lynn have really good chemistry, so we can talk, we can joke back and forth, and incorporate the patient into it as well, so that we're all kind of in the same dialogue box together. We did notice that asking them questions about themselves, getting them to talk to us, that's basically the first step. If they don't communicate with you, then they probably don't trust you. So if we can get them out of their box, like if they're crying, they're nervous, we just start asking them lots of questions about themselves, what they're doing for the summer, what colors they like, if it's girls with princesses, if it's boys with superheroes. Just trying to get a connection with our patients. That's really important to us. Our patients are just our patients, you know, they're also our friends. So we definitely want to establish that kind of connection first. Our post-operative instructions are very important here because we actually show photos to accommodate or accompany the verbal instructions and written instructions that we give to the patient. For our patients that are numb or who leaves our office numb, we make sure we show them the outcome if they bite their lip or scratch it or pinch it really hard, or even, I guess, just aggravate it a lot. So our pictures are very important. That way they don't actually do this at home, or if they do, their parents will know already what to expect just in case it happens. Also with our crowns, the outcome of if they eat something sticky or chewy, what could possibly happen. So we encourage them not to do those things. I think that our method is a more effective way as to what I've seen already in other practices, only because it gives us the opportunity, like I said earlier, to make more of a one-on-one connection and to make sure our patients are comfortable and happy. We also ask lots of questions as far as, are you okay? Are you comfortable? Is there anything I can do to help you? I think kids, they pick up on adults being personable. You know, if you can connect with them that way, not just playing with them, anybody can play with a kid, but can you show them that you do care? That makes a big difference for our patients as well.